patient in this sitting position, because when you're lying down, you can't. You can't really shake in this way. Okay, so I grab the patient's wrist this way. Probably the best way to do it is with your fingers of both hands kind of under the wrist, and both thumbs on the top of the wrist this way. Yeah? And then you might want to try to shake a little bit just to test to see if the arm is relatively relaxed. You can do this with one hand if you want to as well. Okay, but okay, yeah, I'm right on her wrist joint right here. Like my middle fingers are kind of right on the wrist joint. You can actually, if I want to, I can bend her wrist joint this way. But first thing you do is you kind of like take out the slack of the arm if you want to. Like you can lean back slightly. I'm not really leaning back. My weight is kind of going back onto my right leg just so that I'm kind of pulling the arm out a little bit, and then you just start off slow. So this is like really gentle or small amplitude, and then you can get larger amplitudes. The larger the amplitude, the slower the frequency. Okay. And then ideally, if you pass this, the other arm.
You're anchoring in my wrist, right?
Yeah.
Yeah, you're anchoring. I can feel.
Yeah.
I think my elbow is doing more of it. Flip flop.
Yeah. You can, let's see, you can soften the elbow a little bit. Sometimes what happens is if you position the arm this way with the palm facing down, because the elbow bends this way, when you pass a wave through the elbow, it's not really passing through the elbow because it can't move in this dimension. So what you can do is like kind of turn the hand this way and then see if you can do that. Of course, that makes it a little bit more awkward at the wrist, but
maybe that's one hand better. You shake hand hold.
Okay. But this has a close relationship with the pulling technique. You can start off with a pull this way, and so you remember when you're you can just do simple pulling this way, but it's best to do like a push-pull even when you're talking about the shoulder joint. So if I want to pull the shoulder joint, I'm pulling with my right hand at the wrist, but my left hand is sort of pushing, applying like a counter force to the shoulder this way.
Much effective.
Yeah. But you can alternate this with your shaking. So you can, and then you can go right into the shaking this way. Let's see if this is good. Yeah, sometimes maybe if you have another hand at the elbow joint, it helps to loosen up. And then again, you can go back into the pulling. When you do the shoulder, in addition to just pulling out this way, if you want to, you can like add like a twisting element to it. I know what I said about the elbow joint, but what happens when you do this with the full arm is that generally the whole, like the humerus is turning this way too.
Right here.
You feel that right there?
Very
okay.
true, yeah.
Okay.
A good feeling.
Oh, okay. Another thing I can talk a little bit about is I can start to talk a little bit about points. So when you're working on, like, say, the shoulder joint, my right hand is pulling the wrist. My left hand, again, it can be applying like this counter force. But at the same time, if you want to, you can also start applying pressure to certain points of the shoulder. One of my favorite points to put pressure on is like lung 1, lung 2. Like, so lung 1 is right below the if you follow the clavicle out, lung 1 is right here, yeah, in this depression just immediately below the lateral extremity of the clavicle. Lung 2 is like a little bit below that, like about 1 cent below that. So I usually go for lung 2 here, and I'm just pressing with my thumb, and also I'm kind of applying a, again, a counter force this way. If you want to, you can also, although I can't really put pressure with my pinky, so if I want to do other points on the back of the shoulder, I'll switch my hands. So if I want to do like SI9 or SI10, which are on this back part of the armpit here, then I'll switch hands, use my thumb here, and then same thing, yeah, pull. Okay. But yeah. Small intestine 9 and small intestine 10.
Small intestine points like that are pretty localized, aren't they?
Yeah.
So you're just trying to go after the area you're pressing on.
Yeah. So they're just good points to press on when you're, because they're, especially if you're trying to work on the shoulder itself. These are like important local points of the shoulder. Okay. Okay. I'm gonna actually go through all the techniques with the arm first, and then we can do the legs, because I don't want to have to keep switching positions. Okay. If you wanted to, Okay, do like a pulling just for the elbow. Again, you can have one hand just proximal to the elbow joint, and the other hand just distal to the joint. And then my right hand here is going to be kind of pulling, while my left hand doesn't exactly slide up this way, but it's kind of anchoring so that I'm able to distract the joint. So like this, yeah. And same thing with the wrist joint. This right hand can be applying the pull, while this left hand is the anchor, and you're just opening up and distracting the joint. This is another place where you can apply pressure on a point. You have your this point, pericardium 6, which is, on most people you can see these two tendons on this aspect of the forearm. It's kind of between these two tendons, like between these two lines here, yeah, and about 2 cun or two thumb widths proximal from the wrist joint, so about here. So usually I use my middle finger on like pericardium 6, and I can put pressure, and at the same time have this hand act as an anchor, while my right hand is pulling out the wrist joint this way. So again, if you want to isolate your pull to more distinct joints, then you just surround the joint, like one hand on more proximal, serving as the anchor, the other hand distal to the joint, and with the distal hand you're pulling. You of course can do pulling of the fingers. Again, just to isolate things, doesn't seem like this hand is doing much, but it's just making sure that this pull doesn't act all the way through the arm. It's just trying to isolate it to like the fingers. Yeah. Okay, so that's like the shaking, some of the simple pulling. Okay.